carrying on a discussion about the pain handbook. So what we'll be doing today is going through bit of chapter 2, which is about the topic is
getting to know
yourself. Getting to know yourself, right? Now that's a very important topic because most of us are depending too much on what a guy with a white coat, doctor has to say, or a physiotherapist has to say, or whoever else. It's very, very important. You lived with yourself forever, for as long as you've been since you've been born. So it's important you get to know yourself far better than anyone else, okay? Rather than just depending on us, right? So here's Kunal with me, and what we'll do is we'll do a little bit of a question-answer thing, and it'll be very short ones. If you have any questions, you can write down here, or maybe you can even ask right now. Okay, so we'll just get started. So Kunal.
Sure. So, sir, we've seen most of the people coming here and blaming their parents or their ancestors, like, because my father had a big back pain or a knee pain, so I think I have a knee pain and I have to suffer with it for life because it's in my genes. What do you have to say about it?
Yeah, so actually it has nothing to do with genes. Actually, it's about what runs in families, as they say, is not being physically active. Okay, so what's very important is get active. Rather than saying because the father had, mother had arthritis, back pain, these things don't happen because it's running in families actually, okay? Physical inactivity is very, very important. Rather than blaming parents, what we need to be doing is getting on with it. It's simply about getting moving. That is very, very important. There was a very interesting study that actually came out recently. It was talking about even taking it further, saying actually aging also has nothing to do with arthritis, or very minimal, okay? Yes, it's degeneration is part of aging, but the point is, does pain have to come with it? Okay.
Yeah.
So it's again, what they're saying is that looking back at, skeletons from mummies 2,000, 3,000 years old and all that stuff, okay, or even longer, older, and saying effectively, when you're inactive, those things happen more and pains more. All right. Yeah. So it's not only about aging and stuff like that. So it's not what your genes are, it's not about aging. The regular things that you're throwing, at people, it's just wrong. It's completely wrong.
So is it like some arthritis more about, the way we get grey hairs, the way we get wrinkled skin?
Actually, that's very interesting.
Yeah.
It kind of is. So not everyone gets grey hair. Not everyone has very wrinkled skin at 85 years of age. I mean 85 maybe, but at 60, some look very different from others. So it's just one of those draw of luck almost, plus how physically inactive you are. So it's a combination of the two things. Okay. So changes in the bones. So again, what you see in MRIs and X-rays, that's one part of the story.
Yes.
Most of the times, we now know even as much as more than 50% of people at say 30 years of age, who have an abnormal X-ray, might not have any back pain or knee pain. All right, might not have any back or neck pain. So that's very, very, very important for us to know that. Okay, so we have to look at the patient. Before that, even hear the story, what's going on.
Yeah.
Last of all, then see what the investigations are saying. So it's a combination of the things, rather than just saying treat the X-ray. I mean, what's the point of that?
So we have a skeleton here kept like that. So can you throw some light about,
Yeah, done. Throw it. So the thing is, tell me, what's the question?
So basically, it's about. So you lifted it, right?
Yeah.
So this is the one part of the human body which is missing a lot of muscles.
Yeah.
So can it move if there are no muscles?
So this is, thanks for that, because this is my favorite line, this one. What happens is, in scary movies, they always show a skeleton. The skeleton comes walking towards you, all that, and you're supposed to get scared. As a matter of fact, here it's, done in a way where things are stuck together. Otherwise, if you take a skeleton together, just the bones, they cannot even stand on their own.
Oh.
Alright, so like this guy, if you go to the orthopedic clinic or like a clinic like ours, we used to have it earlier, not anymore, but there'll be a skeleton like this. It'll have a rod up its backside, okay, and there'll be wires all over the place to hold it upright. Okay, so it can't even stand on its own. Alright, that's number one. Second is, how can movement happen if it can't even stand? Alright, so the skeleton that we in our heads enforced by doctors, because this is what you see when you go to the clinic, or movies, they scare you, right? The skeletons can't move on their own, the bones can't move on their own. So and they fall apart, as you see here, all right? So it just fell. So the point really is, the muscles, the ligaments, okay, the tendons, they are the ones that are keeping it together and then moving it as well, all right? Now, point really is you are made to move.
Yeah.
Right. And again, one thing I keep saying is, you even moved before you were born. You were born to you moved to be born, right? So as a sperm, you ran, okay, and hence you were born, kind of a thing. So it goes even for the skeleton.
Yeah.
And again, one thing is, if you look at the skeleton right here, look at this guy. I don't know if you can see the face. Look, he's smiling. All right. Most people, they don't realize that there are a lot of muscles that are used for smiling again.
Yeah.
Okay. But if you remove all those muscles, actually at the end of the day, the skeleton does smile. All right.
Yeah.
So effectively, what I'm saying is, we have to move. Those muscles are made for that. Okay. And it doesn't stop at that only. The brain is. This is one of the major things that we actually have a brain.
Yeah.
Is to get us moving. All right.
Yeah.
So yeah, that's what it is about it. So rather than thinking too much about what is the detailed functionality or something, we need to understand that muscles are there to get us moving.
Yeah.
Okay.
So can I just hold it, sir?
Sure.
So these are like in parts we see in the X-rays, and then we just worry about those particular areas that this is degenerating, that is generating. As sir is saying, we need a lot of muscles to move that. If muscles are moving right, you might protect yourself from a lot of pain which you are already suffering from. So, sir, can you just take us through, because I mean, we have been hearing too much about the relevance of spine, which is there in the body.
Yeah, I was trying to save it for next talk, but anyways, so the whole idea is, this is the spine from the skull. It goes down here till here. So the sitting people tailbone that they call it. So this is right here. Now, forget about the sacrum and the coccyx. This part is the sacrum and the coccyx. Okay, but let's talk up till here. The 7 bones around here, they're called cervical. Okay, you would hear people saying, "Oh, I have a cervical." You know what? Everyone has cervical, and everyone has 7 cervicals, not 1. Okay, so there's 7 vertebral bones around here. Then thoracics, there are 12 of them where the ribs are. So up till there at the back are the 12 thoracic bones, and then 5 are the lumbars. So 5 at the lower back are the lumbars. So from the skull up till where you wear the belt, around there, you have 24 bones that are sat on top of each other like that. Okay. Now what happens is, it's like in a car, it's like a chassis, right? So it's effective like a chassis of the body, the spine, right? Now the neck part, the cervical part, is very mobile in all directions. So bending forward, sideways, diagonally, whatever, cervical does that. Now thoracics, primarily, they are very, very good with, they do very limited flexion extension, all right? So forward, backward movement is limited up this part. The primary movement is actually more of a rotational movement that actually happens in the thoracic area. Now this is very important, I'll come to that why. And then lumbars is where the forward backward movement happens. So lower back is responsible for more forward and backward movement. Okay, all right. Now why the difference between the 3? Because there's a transitional area here, very, very mobile, and suddenly there's a transition to only more rotation.
Yeah.
And then suddenly a transition around here where it's only rotation, and then suddenly it's forward backward movement only.
Yeah.
So those areas are very commonly, and again lower down, very, very fixed, and then lumbars. So yeah. So these are the areas where disc bulges and all that happen when you do sudden movements.
Yeah.
Most people who play golf or tennis or a squash, they don't know what body part should be doing what. They're just doing the activity without thinking too hard. Right? Effectively, they're doing the reverse role. If the posture isn't great, whatever thoracic should be doing, the lumbars are being forced to do, and then injury is being created.
Yeah.
Right. So what's important is to understand what body parts are made for what. Right. And then again, the rest of it as well, what the rest does. So it's the main engine, really. I mean, it's a very, very important part that people need to get what a spine is all about.
Yeah.
And we'll be discussing all that more in a lot of detail later.
Sure.
Okay? So I think that's a lot for now, really. Okay.
So just to finish with one last question, sir. I mean, yes, I think I have a brain to think, but I still want to know: does our brain form because we are supposed to think? Is the brain more for thinking?
It's to think to move. So the idea is, yes, but bigger one is actually movement. Because if you don't move, suddenly there's nothing that we are about. Movement is what differentiates us. Like, come on, I mean, getting a little philosophical, but look at the whole universe. If it isn't moving, moving is the most important part to it. Thinking is what we think we do. Okay, so it's a little like that. So I think movement is number one.
Sure. We put this question because I think the world is thinking more and moving less nowadays. So it's becoming reverse. So,
Totally. Yeah.
So that's it for today then.
Yeah, that's pretty much it. Any questions at all? Cool. So that's it. And what we'll do is we'll come up with very, very short ones like this, 4, 5, 10 minutes. From now on, we'll start announcing when we'll be doing these things. So what we'll have is a particular day and a particular time every week.
Yeah.
And I think that'll be the better way to do it then. Okay. Thank you, guys.